In tonight's Big Story Breakdown, we're following the federal dollars flowing into Oklahoma and what happens when some of that money stops. Federal funding helps pay for everything from education to food programs to services Oklahomans rely on.
And tonight, one school meal program is feeling the impact of losing that support. Fox 25's Paige Taylor explains how it's affecting school districts across the state.
The federal program has provided a third meal for students who attend Hayworth Public Schools, a rural district in McCurtain County.
In 2011, USDA sent a memo to states that basically stated schools could be allowed to participate in the program if they go at least 1 hour more than the required length of a school day. So in Oklahoma, that means we're required to go a minimum of 6 hours. So schools that went for 7 hours could qualify for this extended learning time portion of this third meal, as it's commonly called.
Meals are brought directly to students' classrooms in Hayworth before the end of the school day. Superintendent Jared Lundry notes many of the district students are on the school bus for up to an hour and a half.
It's especially beneficial for our students because we are one campus and we have to feed pre-K through 12 in one cafeteria with one group of staff. So our pre-K and kindergarten are starting lunch as early as 10:30 in the morning.
Just days into the school year, districts learned the extended learning time aspect of the program is being discontinued. This week, a memo from OSDE let districts know they must implement an after-school program of at least 30 minutes in order to receive federal funding for the meals.
Well, it's really not very feasible for us, especially on a very quick turnaround basis. The issue with a small rural district like Hayworth is we have to run 8 bus routes in our large geographical area, and we cannot afford to keep students for an extra 30 minutes and run multiple bus routes. Many of our students who need this third meal the most are the ones who depend upon the buses for transportation.
We asked what initiated the discontinuation of the extended learning time aspect of the program.
This was brought about during a normal management evaluation time frame, which USDA conducts with the state of the child and adult care food program, and part of that management evaluation are accompanied reviews. And while they were here, they went on several accompanied reviews with us and found some discrepancies in that program of the expanded learning time and recommended that that be discontinued.
The state superintendent echoed that sentiment.
I think we've gone so far down the path that corrective action may be difficult. And this is unfortunate for those that are doing the right thing. But let me reiterate, schools can pivot to an after-school program to ensure children are indeed fed.
Lundry says he called USDA to ask what their role was in this decision.
They said while they do support the state's decision, because it is ultimately the state's decision, USDA has not changed their guidance. They have not said the extended learning time is not an option. They still go by the same policies, the same procedures, the same allowables. So ultimately, this is a state level decision. And we are leaving federal money on the table that can go directly to our students that doesn't cost the district any money because we get fully reimbursed.
Paige Taylor, Fox 25 News.
Schools can continue the program up until September 30th. Hayworth's superintendent says they're working with local churches and organizations to see how they can help in the future.
An interactive map is showing the federal government's footprint and impact across states and communities nationwide. The cost to your community map combines state and congressional district level data on federal personnel funding and infrastructure to show how government resources are being distributed. You can see the state of Oklahoma has lost nearly 10% of its federal employees since 2024. The state also has lost about 1% of federal assistance and 14% of the value of federal contracts.
Federal dollars pay for more than just school food programs and hospital programs. They also pay for things like Medicaid, public safety grants, and education. For example, Oklahoma's Education Department says Title I money is being used by districts to support economically disadvantaged students. And the Rural Education Achievement Program provides federal money specifically to small and low-income rural districts.
Getting federal money doesn't always mean Washington picks up the tab. Some federal programs require Oklahoma to put up money of its own. For example, Oklahoma's Department of Rehabilitation Services says its vocational rehabilitation program gets roughly $4 federal for every one state dollar spent. That means the state has to put up its share to access the federal money. And when Oklahoma can't provide enough of that match, the state can end up leaving millions of federal dollars on the table.
The state of Oklahoma asking Washington for more money. The Oklahoma Corporation Commission asked congressional leaders to fully fund state natural gas pipeline safety grants. OCC asked Congress to provide the state with about 78.5% of eligible program costs and make sure the grants are not conditioned on responsibilities outside a state's pipeline safety authority. Officials say it's essential federal funding keeps pace so states have the resources necessary to protect the public. And Oklahoma College is returning to federal lobbying after nearly 2 decades. Western Oklahoma State College took in nearly $1.5 million in federal TRIO student support services grants last August. The program serves low-income, first-generation, and students with disabilities. This comes as federal support for low-income and first-generation college students has become an increasingly prominent issue in Oklahoma. The lobbying registration identifies education as the general lobbying area, but does not specify legislation or policy priorities.
So when Washington looks to cut spending, not every federal dollar works the same way. According to the Congressional Budget Office, a large share of federal funding is mandatory, with funding generally determined by laws already on the books. Think Social Security, Medicare, and Medicaid. Discretionary spending is different. Congress decides how much to fund through the appropriations process, generally revisiting those decisions each year. That includes funding for many federal agencies, programs, and grants. Congress can also change mandatory spending, but that generally requires changing the laws governing those programs. Members of Congress don't have many options when it comes to tackling an exploding national debt that just passed the $40 trillion mark.
As Fox 25's national correspondent Matt Galko reports, debt experts say tough choices have to be made now before deeper cuts would be necessary later.
$40 trillion and counting. The United States is carrying a heavy national debt that's getting bigger at a rapid pace. It took just 5 months to go from $39 trillion to $40.
The $40 trillion is a big number. We're going to have to grow our way out of this.
The national debt was around $20 trillion when Donald Trump first took office in January of 2017. It was approximately $27 trillion when Joe Biden entered the White House in January of 2021 and was around $36 trillion when Trump started his second term last year. The largest budget items annually include a combined $2 trillion for Medicare and Medicaid, around $1.6 trillion for Social Security, and nearly $1 trillion for defense. Executive Vice President at the Peter G. Peterson Foundation, Brett Loper, has been advocating for serious reforms to get the exploding debt under control.
The reality is you're probably going to need a little more revenue. You're likely going to have to cut some spending, Medicare and Social Security that are designed to support our seniors and our elderly. We're going to have to make some modest adjustment to those over time for future generations.
Healthcare costs are an ongoing battle between Democrats and Republicans, with Medicare for All stances taking a prominent role in the midterm elections, especially among progressives.
Medicare for All is arguably the most important priority. It would save money and it would save lives.
It will raise taxes on everyone, including the middle class, including the working class.
Nailing down how much that would cost is tricky. The Congressional Budget Office last estimated a move to Medicare for All would add another $1.5 to $3 trillion annually. A Yale study released in July that is yet to be peer-reviewed estimated the country could save more than $1 trillion annually because of lower drug prices and less fraudulent billing from insurance companies. The study also predicted more than 100,000 lives could be saved as well. Congress raised the country's debt limit by $5 trillion to around $41 trillion last year. They burned through so much of it already, it's estimated that number will have to be revisited again as early as the first half of 2027. Reporting in Washington, I'm Matt Gelka.
The debate over federal spending may be happening in Washington, but the effects don't stay there. Federal dollars help support Oklahoma schools, healthcare, transportation, food assistance, research, and local governments. That means every cut, grant, or change in Washington can eventually show up much closer to home. And that was tonight's Big Story Breakdown. You can learn more about the federal dollars flowing into the state on our website, OKCFox.com.
Plus, you can watch all of our previous Big Story Breakdowns on our YouTube channel. Just scan the QR code right there on your screen or search OKC Fox.